Greetings, dear colleagues. Today I want to talk with you about modern methods and algorithm of etiological diagnosis of tuberculosis. Etiological diagnosis of tuberculosis should provide availability of the examination for the entire population regardless of the geographical characteristics of the place of residence, of the social status of the patient in another laboratory suitably equipped. Use of research methods with proven clinical and economic efficiency in order to fully meet the requirements for the equality of diagnosis and control of treatment of patients with tuberculosis, and rapid implementation and effective use of innovative approaches. Etiological diagnosis of tuberculosis begins from tasks the same as confirmation, exclusion of the causative agent of tuberculosis, identification of the pathogen, and investigation of drug sensitivity of the pathogen. For confirmation or exclusion of the causative agent of tuberculosis, we can use microscopy, cultural methods, molecular genetic methods. For identification of the pathogen, we can use culture methods, MGM, molecular genetic methods, immunochromatography. And for investigation of drug sensitivity, we can use culture methods, MGM, and immunochromatography. And again, for confirmation, exclusion of the presence of a tuberculosis causative agent, methods are microscopy, culture methods, and molecular genetic methods. On this slide, you can see some devices for these methods. Microscopy. Sensitivity at 65%, but detects 90% of infectious cases. Specificity is about 95%. The prognostic value is influenced by the epidemiological situation. The number of acid-resistant mycobacteria characterize the degree of epidemic danger of the patient and the severity of his disease. Therefore, microscopic examination should be not only qualitative but also quantitative. Light-emitting diode fluorescence microscopy, LED-FM, is recommended by the World Health Organization to replace conventional Ziehl-Neelsen microscopy for pulmonary tuberculosis diagnosis. Uptake of LED-FM has been slow. One reason it is a reported loss of specificity compared with Ziehl-Neelsen microscopy. On this slide, you see special test tubes for research using the culture method, such as sowing on dense nutrient media and sowing on a liquid nutrient media in an automated system, BACTEC NGIT. On this slide, you can see the table which characterizes the deadlines for obtaining results. For dense media, Liebenstein-Jensen Finn, positive result of cultural detection of Mycobacteria tuberculosis is about 10-74 days. For BACTEC MGIT automated system is about 7-42 days. Deadlines for obtaining results: negative cultivation result for dense media is about 74 days. For BACTEC MGIT automated system is 42 days. While microscopy and culture methods continue to be indispensable for laboratory diagnosis of tuberculosis, the range of several molecular diagnostic tests, including the nucleic acid amplification test and whole genome sequencing, have expanded tremendously. They are becoming more accessible not only for detection and identification of Mycobacterium tuberculosis complex in clinical specimens, but now extend to diagnosing multi-drug resistant strains. Molecular diagnostic tests provide timely results useful for high-quality patient care, low contamination risk, and ease of performance and speed. Stages of analysis on tuberculosis biochips. First of all, it's sampling, blood drawing, destruction of tuberculosis bacilli in phlegm leading to release of DNA, PCR amplification for subsequent genetic analysis of DNA fragments responsible for resistance towards anti-tuberculosis drugs, and hybridization between DNA fragments extracted from Mycobacteria and the probes immobilized on the biochip, and analysis of the fluorescence patterns obtained from different parts of the biochip by means of chip detector 1. On this slide you can see the device for real-time PCR. Hain life science test systems for molecular genetic diagnosis of Mycobacteria are based on the unique DNA strip technology, hybridization with DNA probes. It is a reliable technique for the routine diagnosis and analysis of polymorphism associated with outliers, detection of Mycobacteria and their resistance to antibiotics. Hain life science tests kits are approved for use by the World Health Organization. GenExpert MTB, the method for detection of Mycobacterium tuberculosis that include the first step is sputum liquefaction and inactivation. Second step is transfer of 2 milliliters after 15 minutes. Third, a sample is automatically filtered and washed. 4. Concentrates bacilli and removes inhibitors. 5. Ultrasonic releases of filter-captured organisms to release DNA. 5. DNA molecules are mixed with dry PCR reagents. And 6. Nested real-time amplification and detection in integrated reaction tube. Identification of the pathogen by cultural methods, MGM, and immunochromatography. On this slide you can see the table with characteristics of some methods like biochemical, immunochromatographic, and MGM. For biochemical methods, identification Mycobacterium tuberculosis complex, yes. Species identification inside Mycobacterium tuberculosis complex, yes and no. Species identification non-tuberculosis Mycobacteria, yes. And test time for biochemical method is 30 days. For immunochromatographic method, identification Mycobacterium tuberculosis complex, yes. Species identification inside Mycobacterium tuberculosis complex and non-tuberculosis Mycobacteria are no. Test time is about 15 minutes. Molecular genetic methods, identification Mycobacterium tuberculosis complex, species identification inside Mycobacterium tuberculosis complex and non-tuberculosis Mycobacteria, yes. And test time is about 1 day. Very quick. The next step of etiological diagnosis of tuberculosis is determination of drug sensitivity of MBT and anti-MB. Anti-MB is non-tuberculous mycobacterial infection. Determination of drug sensitivity of the pathogen, cultural methods. The method of absolute concentration, technology backtag, and technology sensitivity. The degree of suppression of cultural growth in vitro in the presence of antibacterial drugs is evaluated. Molecular genetic methods, technology biochip TB test, PCR-RT, Hain test, and GenExpert. Mutations associated with MBT resistance to anti-tuberculosis drugs are detected. On this table you can see the test time for some methods of determination of drug sensitivity of the pathogen. For method of absolute concentration, test time is 21 days. For Bactec MGAT, 10-40 days. Sensititor, 10-40 days, and for molecular genetic methods, is about 1 or 2 days. As can be seen from the present diagram, the least amount of time is spent on molecular methods and the most time is spent on culture matter with thinning. Currently, there are validated MGM detection of mutations associated with MBT resistance to the following drugs: isoniazid, rifampicin, ethambutol, kanamycin, coprimycin, and fluoroquinolones. There are no standardized MGM definitions of mutations associated with MBT resistance to the following drugs: PASC, ticloserine, pyrazinamide, and proteonamide. How successfully can we determine the resistance of MBT to pyrazinamide by cultural methods? 57 isolates showed resistance to pyrazinamide on MGAT. Repeated testing of these isolates on Bactec shows that 33 is about 58% of them were resistant to pyrazinamide, and 24, 42% were sensitive. According to modern Russian clinical guidelines, pyrazinamide is included in chemotherapy regimens regardless of laboratory data of the resistance to it of the pathogen isolated from the patient. Culture methods for determining resistance to pyrazinamide often give false positive results. It is necessary to create rapid tests to determine the resistance to pyrazinamide. Thus, modern molecular genetic methods make it possible to identify mutations of resistance to the same anti-tuberculosis drugs, resistance to which can be reliably determined by culture methods. Drugs, mutations of resistance to which we cannot reliably detect today by molecular genetic methods, are not recommended by international experts for routine inclusion in culture tests either. In all cases, the results of the molecular genetic study of MBT resistance to drugs must be compared by culture methods, according to the results of which, if necessary, it is necessary to adjust the chemotherapy regimen prescribed by the results of the MGI. Algorithm for the diagnosis of tuberculosis. You can study this algorithm in more detail in the methodological guide, Expert Opinion of the European Tuberculosis Laboratory Initiative Core Group members for the World Health Organization European region. Basic principles are using GenExpert as an initial test, performing microscopy only for samples with a positive GenExpert result, using the Hain test to detect mutations of resistance to PTP. It is protein tyrosine phosphatase on the second row. The choice of the research algorithm depends on epidemiological situation in the region, number of patients with HIV plus tuberculosis co-infection, profiling of the institution's bed fund, tasks that clinicians set for the laboratory. When creating an algorithm for etiological diagnosis, it is necessary to assess the feasibility and possibility of high-quality performance of the entire spectrum and the number of studies necessary for patients in this laboratory. In the absence of expediency and or the possibility of performing any types of research to the required extent in one's laboratory, it is necessary to consider concluding contracts for conducting the studies in another laboratory, which will provide guarantees of their high-quality performance. On this slide, you can see costs of diagnosis and treatment of patients with drug-resistant tuberculosis. And as you see from the graph, diagnosis is not the most expensive part of treatment. Efficiency and quality of etiological diagnosis of tuberculosis. 70% of decisions in clinical medicine are based on documented by the results of medical laboratory tests. Therapeutic and diagnostic process as a system. A system is a set of elements interconnected and acting in concert to achieve a certain goal. One of the most common reasons for poor system performance is a lack of information flows. Less than half of newly identified patients have etiological confirmation of the diagnosis. The system begins from making a clinical diagnosis, then etiological diagnosis and epidemiological monitoring, and then therapeutic process. Laboratories should not provide the clinic with test results whose quality is not confirmed by an effective quality control system. Causes of errors in medical laboratories include pre-analytical, analytical, and post-analytical stages. Quality assurance is the main principle of the organization of the medical and diagnostic process. Pre-analytical stage. Building an algorithm for etiological studies in accordance with clinical needs, culling of the incoming diagnostic material, increasing its information content, incoming control of reagents and consumables. Analytical stage, intra-laboratory quality control of ongoing research. Implementation of standards. External quality control, participation in the federal system of external quality assessment of laboratory research. Post-analytical stage, registration of the results of analytic procedures, laboratory information systems. Continuing education of laboratory and clinical professionals on the clinical use and interpretation of etiological test results. Analytical stage. In laboratory quality control is the main mechanism that allows you to track and correct errors in a timely manner before transferring the results to the clinic. External quality control, retrospective assessment. Post-analytical stage. Laboratory management should provide appropriate educational and training opportunities to all laboratory personnel as well as, if appropriate, to consumers of laboratory services. It is necessary to provide the laboratory with an information system that allows for personalized accounting of research results and analyzing the effectiveness of the laboratory. Resume. The main criterion for the quality of laboratory studies is their sustainability for clinical use. Investing resources in etiological diagnosis is advisable only if the principles of using the results of laboratory tests in the clinic are changed accordingly. That's all. Have a nice day. Goodbye.